Hello guys, today I'm making the most requested video I've ever got on my channel. That is a strategy video for final year students. And it has to be because final year is the transition point which decides whether you're going to be a good doctor or you'll remain an MBBS student forever. Because until third year, until now, you were in this chill phase that you were just attending the classes, you were just studying for passing the exam sake, and you were doing whatever you feel like. But once you enter final year, you suddenly start realizing that this is going to be my transition point. This year is going to decide whether I'll become a doctor or my entire MBBS journey is going to be a waste. So now you start getting fired up. Now you start reading seriously. You start attending your clinical posting seriously. You start to try to understand all the clinical cases. You start try to present the cases. But in this chaos, you don't know what is important, how to approach this final year, what else to study, and should you even be preparing for NEET PG in this phase? And if yes, how do you actually manage the NEET PG preparation and your final year side by side? So in this video, I'll try to clear all your confusions and I'll help you in the transition of being a doctor. What are the main subjects you need to focus on during your final year? They are just four subjects, that is your medicine, surgery, OBG, and pediatrics. And all others are the allied subjects in these like orthopedics, psychiatry, dermatology, radiology. So I'll help you approach these subjects in such a way that it will help your prof exams as well, and it will lay a strong foundation for you to enter the internship and not to be running cluelessly. When you enter the final year, you have this confusion that how to approach these subjects exactly. Should you start reading standard textbooks now, or should you go through a concise notes and prepare for prof exams and prepare for NEET PG separately? And you will have the postings as well, right? So when you look at all of this, your mind is in chaos that what exactly to study, how exactly to study. And since time is actually running out, you end up choosing the wrong step. So what I want you to do is I want you to focus on the subject based on your postings. Now let's suppose you are posted in surgery for the next 1 month. So now for the entire month, I want you to focus on surgery. And what to do during these postings? See, you will be posted in a unit, or you can be posted in multiple units as well, and you will have this rotation, right? One day you will have OT, one day you will have OPD, and another day you will have wards. So I want you to learn at least these basic cases which I'm going to tell you now. So there are long cases and short cases, right? In long cases, I want you to make a list: breast, thyroid, abdominal lump, hernia, varicose veins, and peripheral artery diseases. So these six should be your bare minimum list. And for short cases, fibroadenoma, hydrocele, lipoma, sebaceous cyst, and ulcers. Whatever list I have told you, this has to be your bare minimum. If you are able to learn more than this, or if you are able to see cases more than this, then it will be a bonus for you. But these 11 cases has to be your bare minimum. So make it a point to cover all these 11 cases during your clinical posting, during your surgery posting. And why these 11 cases? Because these are the cases you're going to see day in and day out. And these are the cases which the NEET PG examiners are going to frame questions on. And also, if you're well versed with these cases, you'll be able to handle them well in internship. What are you supposed to do? So I want you to follow these cases right from the OPD. Let's suppose you have your OPD posting. I want you to observe what your surgery PG or the surgery consultant is doing. When the patient enters, how does he extract history from the patient? What all questions does he ask? Keep a short diary with you or keep your iPad with you and keep making notes. Suppose a patient, a 40-year-old female, came with a history of lump in her left breast. Now you need to observe what all history is the surgeon eliciting, the duration, the progression, the family history, the risk factors. Try to observe what all questions are being asked and try maintaining a book, or you can even make a note of it in your iPad. So once you learnt about the history, now observe the examination as well, how the surgeon examines, how the breast lump looks like, and what is the procedure for examination. And if you get a chance, you examine it yourself and try to gain that clinical skill of breast examination. So once you understood the history, once you understood the examination, now it's time you make your own differential diagnosis and discuss it with your surgery consultant or your surgery PGs. So when you have seen this patient, I want you to go back and read the topic of CA breast once you go back to your hostel. And believe me, you will understand it so much better because you have already seen the case live. You've seen the examination being performed. You have heard the questions being asked. So once when you actually go and read the topic from your book, you will understand it far, far better. So whatever extra points you gain by reading that day, you can add on that points in the notes you had made. And there you go, you have a ready-made notes for your prof exams as well, for your NEET PG as well. And also it acts as a reference for you. And the next day would be your ward day. And the patient you saw in the OPD yesterday is now admitted. Now, your job is to take that case and try to present it yourself. Take the initiative. It doesn't matter even if you don't know CA breast perfectly, even if you don't know how to examine perfectly, because you learn from your mistakes. You learn very well from your mistakes. Fumble during case presentation, make errors, make those silly mistakes, and learn from those mistakes. So what you actually did, you actually took the entire history, you examined the patient, and you presented it in front of your consultant. So now you'll actually learn what mistakes you did, what was the history you're supposed to ask, how were you exactly supposed to examine, and what would be the next step, what all investigation you're supposed to do, how do you proceed to manage, what surgery do you do. And you'll also learn the TNM staging when you actually present the case. So what happened by presenting a case, you learned the entire CA breast topic. So now you go back and read the CA breast topic again, and whatever points you had missed or whatever mistakes you did, you add it again to your notes. Like for example, the investigation part, you came across something called the BIRAT score. You had read it in an ultrasound report that she was BIRATS 4A. Now, when you go back and read what BIRATS exactly is, you will understand it better. You will retain it better. And the next day would be OT day, and you see what procedure is being done for her. You see the exact steps. You see what instruments are being used, and you'll also see what structures are being removed. And by doing this, you have followed the procedure right from the admission to her surgery. So you have covered all the aspects of a case. So now whatever the examiner may throw at you, even if it's a long question in your prof exam, even if it's an MCQ in your NEET PG exam, you have actually seen it, right? You have actually seen and understood the topic. Now, however the question might come, you will be able to answer it confidently. So this has to be your approach. Your approach has to be case wise. You follow a case right from the OPD until the surgery is being done or until the patient is managed and being discharged. And the 11 cases which I told you has to be your bare minimum. If you can do more than that, then you'll be on another level. So while studying, you can also solve a few MCQs on that topic. Let's suppose you have completed the CA breast, so you can go and solve the MCQ module on CA breast, so that you will understand better, and it'll be kind of a preparation for your NEET PG as well. So what you did, you made a concise notes, you're learning the concept, you're learning the clinical skills, and you're also preparing for NEET PG as well. And during your posting, try to learn about the instruments, learn about the x-rays, learn about the simple procedures being done like incision and drainage, ICD insertion, or inserting an abdominal drain, Riles tube insertion, Foley's insertion. Because when you observe these cases, it will be very easy for you to perform these during your internship. Try to learn about the different kinds of sutures. You even try to practice a couple of sutures yourself, so that you will be confident enough to perform these procedures during your internship. And you will also have a few questions on these in your NEET PG as well. And try to refer standard textbooks as much as possible. If not, you can also refer to any platform like Marrow, Prepladder, or Cerebellum, whichever you prefer. You can watch the videos and try to solve the MCQs then and there. So let's suppose you have 1 month of surgery posting, and 1 month would be enough time for you to complete these 11 main topics, the concepts behind them, the clinical history, the examination, and also the MCQs of these topics. And it would be the same in your medicine and OBG postings as well. So you need to make a list of all the major cases you need to learn in that posting. Like for medicine, you need to present at least one case on every system, that is CNS, CVS, respiratory. And in gynecology, you need to present an obstetric case and a gynae case. And once you complete these postings, you'll have some short postings, right? You'll have ortho posting, you'll have dermat posting, psychiatry posting. So during that time, I don't want you to fully prepare for NEET PG yet, because you'll also have time during your internship to complete these short subjects. And what I want you to do in your final year during these short postings is I want you to complete the remaining topics which are left in your main subjects. So in your final year, your main focus has to be on building strong clinical foundation and understanding these cases in as depth as possible. Because the MCQs which are going to be asked is the same thing which you have experienced in your final year and in your internship. The questions are going to be like, there was a 45-year-old female with complaints of pain abdomen. What is your next step? Or what is the investigation? What is the differential diagnosis? Something like that. So it's more clinical oriented. And final year would be the most important time to build this foundation. So once you master these clinical subjects, that is medicine, surgery, OBG, and pediatrics in your final year, in your internship, you can cover all the all the remaining short subjects, and brush up on your basics, that is your first and second year subjects. And if you do that, you're going to crack your NEET PG in your internship itself, because you have a strong, solid clinical foundation, and all you need is just to brush up your basics and practice solving MCQs. So in your internship as well, you're going to have main postings and short postings, right? So when you have surgery postings in your internship, you'll actually revise whatever you have studied in your final year. Since you already have your notes which you had made in final year, it will be very easy for you to revise and solve the MCQs in your internship. And you don't have to take a drop year to prepare for NEET PG again. You can easily clear your NEET PG in your internship attempt itself. So let me summarize the strategy for you. Your main focus has to be on the four subjects: medicine, surgery, OBG, and pediatrics. And you will approach these subjects according to your posting. So in surgery posting, you will cover as much surgery portion as possible. And remember the 11 bare minimum cases I had told you. So you're going to prepare those first and the remaining later on. So gain the clinical skills, learn to examine, try to follow the patient right from the OPD until the patient is discharged, and go back and read whatever you had seen in the clinical posting. And during your short postings, try to complete as much remaining portion as possible of these four main subjects. And during your internship, you will revise these again and also complete your remaining subjects, which are your short subjects, and revise your first and second year subjects and be ready for NEET PG. So that's it for today's video. I really hope you'll take your clinical posting seriously and present as much cases as you possibly can, and build a really strong clinical foundation so that your internship and NEET PG goes like a breeze. And don't forget to share this to your final year friend who's also confused what to study exactly. And don't forget to subscribe, because a lot of interesting videos are on its way. Thank you so much for watching.